Hi, my dear students. Have a nice day. And today's topic is anastomosis on the back of the thigh and genicular anastomosis. Two distinct chains of anastomosis can be made out in the back of thigh. One lies partially on the surface of the adductor magnus and partially in its substance. The other lies close to the linea aspera of the femur. These longitudinal anastomotic chains are formed by the branches of internal iliac artery, the femoral artery and the popliteal arteries. If you see this picture, you can see this arterial anastomosis that is existing between the internal iliac artery, femoral artery and the popliteal artery at the back of thigh. The first, what you can see is the gluteal arteries. The gluteal arteries are the superior and inferior gluteal artery. They are the branches of the internal iliac artery. So this is anastomosing with the circumflex femoral arteries. And this circumflex femoral arteries, that is medial and lateral, they are the branches of the profunda femoris, which is a branch of femoral artery. So this anastomosis can be seen. And that is involved in this trochanteric anastomosis. The next is the circumflex femoralis, anastomose with the first perforating artery. And then that is the first perforating artery is a branch of the profunda femoris. Profunda femoris, which is a branch of femoral artery, and this profunda femoris have four perforators, and the first perforator in the diagram, it is giving an ascending branch. This is anastomosing with the circumflex femoris and also the branch of inferior gluteal. So this anastomosis is around the lesser trochanter, that is known as cruciate anastomosis. So this anastomosis we can see at the back of thigh. Then you can see the perforators. These perforators are anastomosing with each other. So the perforating arteries anastomose with one another. And the last one is the fourth perforating artery. It anastomoses with the upper muscular branches of the popliteal artery. So there is a chain of arterial anastomosis or the longitudinal anastomosis exists at the back of thigh. In addition to the above anastomosis mentioned, another anastomosis is also found on the sciatic nerve, which is formed by the companion artery of the sciatic nerve and the perforating arteries. So the next question, what is this companion artery? So the sciatic nerve is accompanied by a small companion artery, which is a branch of the inferior gluteal artery. So this artery runs along the sciatic nerve for some distance before sinking into its substance. So there is an anastomosis existing between this companion artery of the sciatic nerve and the perforating artery. So these longitudinal anastomoses provide an alternative route of blood supply to the lower limb by passing the external iliac and the femoral arteries. Cruciate anastomosis is situated over the upper part of the back of femur at the level of the middle of the lesser trochanter. It is formed from above by the anastomotic branch of the inferior gluteal artery. Then below by the ascending branch of the first perforating artery, medially by the transverse branch of medial circumflex femoral artery, and laterally by the transverse branch of the lateral circumflex femoral artery. So this anastomosis is a connection between the internal iliac artery and femoral arteries. So inferior gluteal artery, it is a branch of internal iliac artery. And the medial and lateral circumflex artery is a branch of profunda femoris, and this profunda femoris is also giving perforating branches, and the profunda femoris is a branch of femoral artery. So this anastomosis is a connection between the internal iliac artery and the femoral artery. So descending branch of inferior gluteal artery, ascending branch of first perforating artery, and transverse branches of medial and lateral circumflex arteries. So this anastomosis is cruciate anastomosis. The next anastomosis is trochanteric anastomosis. This is situated near the trochanteric fossa and supplies branches to the head of femur. It is formed by the inferior division of deep branch of superior gluteal artery. So the inferior division or the descending branch of the inferior gluteal artery, deep branch of inferior gluteal artery. Then the ascending branch of medial and lateral circumflex femoral artery. Then often the next is the inferior gluteal artery. So this anastomosis is a channel of connection between the internal iliac artery and femoral artery. So again, the inferior branch of superior gluteal artery and the descending branch of inferior gluteal artery and ascending branch of lateral and medial circumflex artery. So in the trochanteric anastomosis, we can see the ascending branch of lateral and medial circumflex femoral artery. In the case of cruciate anastomosis, we can see the transverse branch of medial and lateral circumflex artery. So this is trochanteric anastomosis that is seen in trochanteric fossa. Genicular anastomosis is a complicated arterial network that is seen around the knee joint. So the knee joint is formed by the lower end of femur, the upper end of the tibia and the patella. So this anastomosis is seen around the patella, around the lower end of femur and the upper end of tibia. So this network is divisible into two parts, superficial part and deep part. Superficial part lies partially in the superficial fascia around the patella and partially in the fat behind the ligamentum patella. The deep part, it lies on the femur and the tibia, all around the adjoining articular surfaces. How this arterial anastomosis is formed? Medially, the arteries that we can see are the descending genicular artery, superior and inferior genicular artery, and laterally, the descending branch of lateral circumflex femoral artery, superior and inferior lateral genicular arteries, anterior and posterior tibial recurrent arteries, circumflex fibular arteries. So, the descending genicular artery, it is a branch of femoral artery. It is the branch that is given off by the femoral artery in the adductor canal. Superior and inferior medial genicular arteries, they are the branches of the popliteal artery, which is given off in the popliteal fossa. Then, the anterior and posterior tibial recurrent arteries, they are the branches of anterior tibial artery. And the circumflex fibular artery, it is a branch of posterior tibial artery. So the popliteal artery at the lower border of popliteus will divide into two, that is the anterior tibial and posterior tibial artery. So the anastomosis around the knee joint involves the branches of the anterior and the posterior tibial artery also. So this is the formation of the anastomosis or genicular anastomosis around the knee joint. So medially, the descending genicular artery, superior and inferior medial genicular arteries. Laterally, the descending branch of the lateral circumflex femoral artery, superior and inferior lateral genicular arteries, anterior and posterior tibial recurrent arteries, and circumflex fibular artery. So on each side of patella, we can see the longitudinal anastomosis by the medial and the lateral arteries. So this longitudinal anastomosis that is seen on each side of the patella, they are interconnected to form a transverse anastomosis just above and below the patella and above the tibial tuberosity. If you go to little bit more detail of this anastomosis, we can specifically say that the genicular anastomosis takes place as follows. If you see the diagram, you can see that the superior medial genicular artery, it anastomoses with the descending genicular artery and also with inferior medial genicular artery. If you observe the diagram, the superior medial genicular artery is anastomosing with the descending genicular artery above, and it is also anastomosing with the inferior medial genicular artery. Again, if you take the inferior medial genicular artery, you can see that it anastomoses with the superior medial genicular artery and also with a saphenous artery, a branch of descending genicular. So on the medial side, if you see the diagram, you can see that the superior medial genicular artery is anastomosing with the inferior medial genicular artery and also the descending genicular artery. If you take the inferior medial genicular artery, it is anastomosing with the superior medial genicular artery and saphenous artery, which is a branch of the descending genicular artery. Like that, if you take the lateral side, longitudinal anastomosis on the lateral side, take the superior lateral genicular. You can see that it is anastomosing with the descending branch of the lateral circumflex femoral artery and also with the inferior lateral genicular artery. If you take the inferior lateral genicular artery, it is anastomosing above with the superior lateral genicular artery and also it is anastomosing with below with the anterior and posterior recurrent branches of the anterior tibial artery and also the circumflex fibular branch of the posterior tibial artery. So this is how the anastomosis is happening in the lateral side and the medial side. And these are connected by means of transverse anastomosis above and below the patella, above the tibial tuberosity. And this is clear from the diagram. And this arterial anastomosis that is seen around the knee joint is formed by the branches of popliteal, anterior and posterior tibial, femoral and profunda femoris arteries. So this anastomosis, it maintains adequate blood supply to the knee joint and the leg during the flexion of the knee joint when the popliteal artery is compressed and blood flow in it become sluggish. So this provide adequate blood supply to the knee joint and the leg during the flexion of knee joint. So this anastomosis supply the bones that taking part in forming the knee joint and the capture of the knee joint as well as the synovial membrane of knee joint. Thank you.